Hello, everyone. A very good afternoon to all of you. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. You must have come across people, especially women with brown color patches on their face. They look like freckle, like spots forming large flat patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to a study conducted across four Indian cities, reveals that more than 80% of the population presents skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin conditions. Melasma sufferers have been misinformed about aspects of this very common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed, today we are here to know more about the management of melasma from an expert. So let's connect today with our skin expert, Dr. Rhea Shetty from Mumbai. She is consultant dermatologist and have more than 10 years of experience in dermatology and venerology and cosmetology, with extensive experience in clinical dermatology and cosmetology. Dr. Rhea Shetty is a highly experienced professional with a distinguished background in dermatology, venerology, and cosmetology. With extensive expertise in clinical dermatology and cosmetology, she brings a wealth of knowledge to her practice. She is the best hair and skin specialist based in Mira Road, Mumbai. And with her expertise today, Dr. will enlighten us more on melasma and its management. It's a pleasure to have you with us, Dr. Rhea Shetty. Welcome.
Hi, thank you for having me.
So, doctor, today we are going to talk about a very common skin condition, I should say, which is melasma. So, first of all, doctor, what is melasma?
Like you rightly explained in the introduction, it's a very common condition that we come across. It basically is a pigmentary disorder. When I say pigmentary disorder, it is something to do with your melanin synthesis. So, whenever an excessive of melanin due to XYZ reason, it triggers the melanin that's already there and causes the overproduction. As a result of this, few areas of your body, especially the face, becomes the prone areas of sight for the pigmentation. And this is commonly seen on your cheeks, your forehead, and your jaw. Sometimes there are also a few cases where we see it also on the body for a few individuals.
Okay. Now, as I also mentioned initially, there is also a term called hyperpigmentation. And what happens? People in general are more aware of the word pigmentary disorders or hyperpigmentation than the term melasma. They are not very aware of the term melasma as such. और ऐसे में कई बार लोगों को लगता है कि melasma and hyperpigmentation is the same thing. Please enlighten us on that as well. Are they the same or are they different?
So, हम जब हाइपर पिगमेंटेशन की बात करते हैं, it is a very broad term to like hyperpigmentation can be due to various causes. It could be due to your acne, post your acne, you've left behind pigmentary spots on your face. If there is some contact of some cosmetics or some products that you used on your face, some allergy can also cause pigmentation. And then there is something called as melasma, which is prone for individuals. So then again, that comes under the spectrum of pigmentary disorders. So when we tell melasma, it is a part of hyperpigmentation, but it cannot completely encompass the whole area of hyperpigmentation.
Right. So we can say that hyperpigmentation is a broader term and melasma falls under it in a way,
Yes.
right? Okay. And doctor, what are the causes of melasma? Who all are at risk for having melasma?
So when it comes to melasma, it is firstly very common in females. When we see in our OPD, the female predominance is more than males. Approximately 10:1 is the ratio for females being affected more than males. Secondly, if they have been under some hormonal therapy, since one of the major causes for melasma is hormones, triggering factors. So if any oral contraceptives they have been on, or they have been on any other medication, so these are the places where the melasma can be triggered. If there is a good strong family history, a lot of individuals when they come to my OPD, they always say that their mothers or their grandmothers or their sister have a positive history of melasma. So there is this another thing called as genetics, which plays a role for the formation of melasma. Thirdly, if you are you are pregnant, there is, we call this as the masked phase of pregnancy also commonly. There is one, there you can see melasma on a very hard, because of the hormones, the estrogen, progesterone, and everything working on your cells. There the melasma is commonly seen. And if there is a lot of sun exposure with genetic history, this is the other cause for melasma to be triggered. And a few underlying skin conditions, like if you are suffering from hypothyroidism, or you have any other comorbidities where your skin becomes a little dry or more sensitive to skin, is where you can see the melasma more commonly.
Right. And doctor, one more thing, because it's so common in our society, and especially in women, as we have already discussed, we see a lot of women, especially after a certain age, with melasma. And we would like to know, what are the signs, or I mean, do they, grow gradually? Do they extend gradually, or overnight? I can see that, oh, I have, big patches of freckles. So is it like that?
See, it is not an overnight phenomena, but it is a chronic recurrent condition. Firstly, I want to emphasize on it being chronic, because you see a small patch that appears on your malar respect, sometimes on your nose, your jaw, or sometimes on around your upper lip. So it gradually comes as a small spot, and in the due course of time, it keeps increasing to an area where it becomes difficult to hide it, or where sometimes it's not the individual that is affected more, but the front person telling you that yeah, ye kya ho gaya, pigmentation dikkar aa raha hai. So it's a gradual process. It never comes like today night you slept and the next morning all of a sudden you see the pigmentation. So it's always a gradual slow process. Sometimes in some individual it grows rapidly within a few months. For some it takes years to come in picture.
और ये सवाल मैंने इसलिए पूछा था क्योंकि होता ये है कि अगर ये ग्रेजुअली होता है, मान लीजिए एक छोटे से स्पॉट से शुरू हुआ, धीरे धीरे वो फैल रहा है, तो हमारे पास टाइम है इन द सेंस कि अगर पहली बार हमें दिख रहा है कि समथिंग इज देयर ऑन आवर स्किन व्हिच इज नॉट नॉर्मल, देन वी हैव द टाइम एंड टू गो एंड कंसल्ट अ डॉक्टर, अ क्वालिफाइड डर्मेट लाइक यू. तो कितना जरूरी है? बिकॉज otherwise what happens in our society, a very common scenario is that whenever we see something on our skin which is not normal, we'll go for home remedies, we'll go for dadi ka nuska, nani ka nuska, we'll go for over the counter preparations, we'll ask a chemist ki kuch ho raha hai, hyper pigmentation jaisa kuch ho raha hai, because again as I said in the beginning, melasma term humko utna nahi pata hota hai, to koi cream de do, then we start applying over the counter products. और ये सब करते करते हम इतना वक्त जाया कर देते हैं कि जब हमें लगता है कि सिचुएशन आउट ऑफ कंट्रोल हो गई है, जब तक हम डॉक्टर के पास जाते हैं लगता है कि बहुत देर हो गई है, अगर हम पहले आते तो बहुत इजी होता ट्रीटमेंट. सो माय क्वेश्चन इज दैट हाउ इम्पोर्टेंट इट इज टू गो एंड कंसल्ट अ डॉक्टर इनिशियली व्हेन यू सी द simple signs and symptoms.
Like you rightly said here, it is very important that you see a good skin expert who has the experience of dealing with the skin. Sometimes you think that it is due to some XYZ reason, and when you turn up at a skin expert's clinic, it's a different reason. I'm sorry. And what harmful thing is when you go over the counter products, they have a lot of steroids that cause a lot of irritation, a lot of redness, which indirectly makes our skin more sensitive to sunlight. And what happens is, if it was an X amount of pigment that was there on your face, it becomes X plus 5 times more. Because the sun then again starts making your skin more sensitive. You have paradoxal hyperpigmentation. Then the irritation of the creams over the counter, if you use some home remedies that further irritate your skin, make it more sensitive, more irritative, and the time lapse that you've seen, it becomes more severe, more difficult to treat. When melasma we see, there are two components that we see in melasma. One is the epidermal. How much is the epidermal? That is in the superficial layers of your skin. It becomes very easy to treat melasma when it's in the epidermal layer. But the moment it comes to
Right.
the deeper areas of your skin, more time, energy, more complex things to follow, more complex treatments to be followed becomes this. So whenever you see a pigmentation on your face, it's important, go to a skin expert, see what their opinion is, take products that are good for your skin, doesn't cause irritation. You will know what products suit you, don't suit you with the help of a dermat itself. So extremely important to see one whenever you see anything.
Right. And when a patient comes to you with, facial melasma, how do you diagnose? Are there tests, or just by physical examination you can say that yes, this is the melasma and this is the grade, how much it has entered the skin layers?
So whenever a patient comes to me, the first thing, it's a very clinical diagnosis. Like you walk in and you have this classical pigmentation, especially on your malar aspect, your nose bridge, your forehead, your upper lip, and sometimes on the mandible in the older age group. So these are the classical areas of involvement for melasma. Along with this, they will give you a typical history of it increasing post pregnancy or during pregnancy. They will give you history of their family members being affected. And another sign, they'll tell you that it has gradually come to this point. They'll never tell you any history of any cosmetics or any products that they've used and that's caused the pigmentation. So clinical diagnosis along with the history helps us to reach the diagnosis for melasma.
All right. We often say, doctor, especially in this, medical sector, that prevention is always better than cure. Is it true even in this, case of
Yes.
melasma?
It is very true because the moment you talk about prevention, the first thing that comes to everyone's mind is what can you do to prevent such a thing, right? The first thing first, buy a good sunscreen because sun is something that triggers the factors that is there. See, we cannot change the pregnancy hormones, we cannot change the genetic history, but the thing that we can control is the sun exposure, right? So when you prevent, if you have a good diet along with a good sunscreen application, it helps tremendously to at least see the depth of melasma or what extent it, if it has spread to your cheeks, we could have controlled it only to a particular spot, right? So a good prevention strategy and a good diet helps in decreasing the severity of the disease.
Right. So it's very important to use a good sunscreen as per your skin type, as per your working conditions. But then, doctor, talking about sunscreen, there are so many complaints or excuses that people normally, counter to say that I can't use sunscreen because I don't like the white cast, I don't like the sweating it, make me to do, or I don't go out. My, sun exposure is almost negligible. I work from home or I work inside the kitchen most of the time. Why should I use a sunscreen? There are so many complaints about sunscreen that people normally have. How would you like to counter them?
So if this question was asked to us a few years back, I would have understood the concern and I would have been more sympathetic towards the situation that, yeah, I can understand that now the formulation is this, it gives a white cast, it makes you oily or sticky. But over the years, we have such good products in market. It caters to all skin types. Believe me, all skin types, we have a different sunscreen now. We have sunscreen to suit the dry skin. We have sunscreen to suit the acne prone skin. We have sunscreen to even suit the extremely oily skin as well. Now there are so much better formulations that we also see sunscreen with camouflaging techniques with them. So you have a wide basket of sunscreens. You have a wide array to choose from. It's only what suits your skin, and that's where a dermat or a skin expert comes into picture because he or she helps you select the particular product for your skin. So again, this is just a reason to articulate that we can say that nahi ye avoid karna hai, but जाकर there is a solution for every problem. That's what I see and
Right.
look at.
Right. And again, there are so many things for the sunscreen. You need to use sunscreen religiously every day as a skincare, regimen. You need to use sunscreen. Reapplication is equally important. The amount of sunscreen that we are applying is equally important. So, how to apply, how much to apply, when to apply.
Okay. So when we come to sunscreen, any formulation has to be reapplied at least 2 to 3 years, because that's the only way you can protect your skin. If you've just applied like around 9 o'clock in the morning, that application stays good from around 11:30, and then the second application is required. Now, how much quantity is required? We take it according to the three fingertips. At least 3 fingertips is required each pump. When you use a pump formulation, then you pump it on all the 3 fingers. You use it on your forehead, your cheeks, around your eyes. Your neck is also important to be covered while application, and this quantity is enough to cover the entire face, neck, and up to your shoulders.
Right.
So that's the quantity that is required. Your sunscreen has to be reapplied after 3 hours, even if you're wearing a good broad spectrum sunscreen, SPF 50, that is commonly that we see.
Mhm.
Thirdly, that I want to address here is that it is not necessary that your pigmentation can be triggered only when you're out in the sun or or the direct sunlight. Even when you're at home, I am sure we have at least 10 to 20% of sunlight in everyone's house. It's never going to be pitch dark in your house. You will have sunlight in one or the other sources. Even if you tell me that no, the sunlight बहुत minimum है मैम, हमें तो आता ही नहीं है धूप, फिर मैं कहूंगी जो आप लाइट के अंदर बैठते हो, या जो आप फोन यूज करते हो या लैपटॉप यूज करते हो, उसके स्क्रीन से भी जो एमिटिंग लाइट है, उसका इफेक्ट इज सिमिलर. इट्स वी हैव लर्न अ लॉट ऑफ रिसर्च पेपर्स हैज बीन प्रूवन that especially now when previously we were suffering from COVID times, even when you were at home, you were not going out or you were not exposed to sunlight, people had an increased risk of hyperpigmentation. There were patients who were coming in with melasma even when they are at home. So it's not required to go out or be continuously in sunlight. Your phones, your tube lights, your bulbs, your mobile phone. I don't think anyone in this now today's generation doesn't use a phone. So
True.
all of those emit the same light and have the same effect on your skin. So
Right.
sunscreen is a big yes to your regimen of skin.
राइट. और अगर सनस्क्रीन चूज करने में डिफिकल्टी आ रही है, दिक्कत आ रही है, तो अगेन यू कैन टेक द हेल्प ऑफ योर डर्मेट. प्लीज गो, बिकॉज दे विल नो योर स्किन, योर रिक्वायरमेंट बेटर. और जब कहते हैं कि आपको अपना सही सनस्क्रीन मिल जाता है, इट वर्क्स लाइक अ वंडर क्रीम और मैजिक क्रीम, तो लोग उसको इस्तेमाल करते भी रहते हैं. और यही वजह है कि कई लोग तो सनस्क्रीन को एज एन एंटी एजिंग प्रोडक्ट भी यूज करते हैं. दे थिंक कि सनस्क्रीन उन्हें यंग रखता है, व्हिच इज टू एन एक्सटेंट ट्रू, राइट डॉक्टर?
Yes. So what I always tell my patients is whenever you have a reunion of a kind after 10 years, 12 years, if you're religious with your sunscreen, you will be the youngest among the crowd there. That is the effect that the sunscreen can have on your skin.
Right. So it's that important. And of course, it goes beyond saying कि melasma के केस में भी सनस्क्रीन एक बहुत अच्छा प्रिवेंटिव मेजर है. And of course, ट्रीटमेंट पर हम जब बात करेंगे तो हमें और समझ में आएगा कि क्या उसमें भी सनस्क्रीन हेल्पफुल है. तो अब ट्रीटमेंट की बात करते हैं. What are the treatment options, doctor? How do you treat the cases of melasma?
So see, when I see a patient of melasma, first thing first is counseling. It's very important to know that it's a chronic recurrent condition. It's not something that I can completely cure of your face, but I can help reduce the amount of pigment that is there on your face. So counseling to make the patient understand that what you see, we will decrease it, but we cannot completely erase it. Okay. Secondly, once you come to the counseling part, once that is done, when you come to the treatment options, there's a wide array of treatment that you can do. There is something called as in-house treatment, wherein the patient gets himself treated while at home under the medicine, and there is something in clinic procedures. But if you're not very religious with your in-house treatment protocol that has been set for you, whatever treatment you do in clinic is not going to bear any efforts. In fact, there is something called as paradoxal hypopigmentation that can occur post that. So in the in-house treatment, when we see a good sunscreen, a good antioxidant rich diet, and there are a lot of skin lightening agents that we use which are more safer, which are more practical to use, which give good results. If this also doesn't work, we have some oral tablets also that works, that is with the name transamic acid that we use. But that is all a stepwise therapy that we can use, combination, what works best for a patient, how it differs from patient to patient, the treatment level. It's very important. Whenever a patient with melasma especially comes to me, I first tell them to get used to this setup of using a sunscreen, a good lightening agent at home. Because if you don't have that particular setup at home and you're not used to it, then whatever procedure I do, they are very reluctant that nahi ma'am aap aaj kara lo laser, main baad mein kar लूं. बट अगर मैंने आपके ऊपर लेजर किया एंड यू आर नॉट हैबिट, देयर इज नो हैबिट ऑफ यूजिंग अ सनस्क्रीन, it is only going to make your pigmentation worse. Because once you use any agents like chemical peelings, or you do lasers, or you do micro needling for these patients, your skin, your upper layer of your skin is we try eroding it, right? So then that skin becomes more sensitive to sunlight. So if no sunscreen, no protection, no skin lightening agents has been used at home, you are going to have pigmentation more. So this is the way you target or you treat melasma. First, in-house, using a good sunscreen, using a good diet, using agents, and then we can come over to the clinic and use those procedures that can be done.
Right. And doctor, as we are talking about melasma and how to, prevent melasma or treat melasma, there are patients, again, as we said, कि एक एज के बाद melasma के केसेस ज्यादा देखने को मिलते हैं. तो कई बार जब हम पूछते हैं कि आपको melasma हो रहा है, डॉक्टर के पास चलते हैं, डॉक्टर को क्यों नहीं दिखाया, तो एक आम सा जवाब आता है कि ये तो एज के साथ होता है, सभी को होता है. So I'll have to live with it. So my first question is, कई बार कई ऐसे स्किन से रिलेटेड इश्यूज भी होते हैं जिनका कोई अंडरलाइन मेडिकल कंडीशन हो सकता है. क्या melasma के साथ भी ऐसा है या सिर्फ ये अपीयरेंस को लेकर ही, और अगर कुछ लोग इस पर नहीं उनको बॉदर कर रहा है कि उनका अपीयरेंस अफेक्टेड हो रहा है, तो कैन दे लिव विद इट?
So melasma is something that is to do a lot of with genetics, so very predominantly, and then your sun exposure. A few underlying agents which can or cannot increase your melasma is, one is if your thyroid functioning is a little on the lower side, that's the hypothyroid we say. Sometimes there are some few research papers where we've also read about vitamin D deficiency. Also, we see melasma a little bit more in such patients. But if we've ruled out all of these substances, we've not seen any of these comorbidities with the patient, then you can completely safely live with melasma. There is no pressing issue कि ये कोई आपको internally आपको harm कर रहा है, या आपके internal factors से ये ज्यादा होता है, या आपके कोई hormonal बहुत ज्यादा हार्मोन ज्यादा कम हो गए हैं, तो इसमें ये melasma दिखकर आ सकता है. You can perfectly stay with melasma if it doesn't bother you. If that pigment is something that you're okay to live with, it is perfectly safe to be with melasma.
Yeah, but at the same time treatment is there. तो अगर melasma है तो ये सोच के मत बैठ जाइए कि ये तो सभी को होता है, बहुत कॉमन है, हो गया है तो अब इसी के साथ रहना है. अगर आप चाहते हैं तो इसका ट्रीटमेंट ले सकते हैं, और इसके लिए जाना होगा आपको एक क्वालिफाइड डर्मेट के पास. Please don't fall for parlor treatments or quacks. Quackery is increasing rapidly. So don't go for that. Influencers बहुत है आजकल डॉक्टर, and all these influencers on the social media, most of them have very ready quick fixes for melasma as well. तो कई बार होता है कि हम उनकी बातें ज्यादा सुनने लगते हैं, उनको बहुत ब्लाइंडली फॉलो करने लगते हैं, और जो जो प्रोडक्ट्स वो बताते हैं हम सब ले आते हैं. We end up buying like 50 products for our skin care regimen. तो उस पर आपका क्या टेक है?
Now this social media has become so prominent in our life. And along with that, you have those beauty parlors, you have salons that advertise in decreasing your pigmentation. But to be very truthful about it, not everything is made for everyone, right? Your skin type, my skin type, and someone else's skin type can be completely different. What product suits you will definitely not suit me. Or it might suit me to an extent, but it would not definitely suit the third person. So whenever you see a certain product on social media, that know that that product might have worked for that patient or that particular individual, but it definitely should not be that हाँ अब उस पर काम किया है तो मुझ पर तो definitely काम कर लेगा. मैं जाकर फार्मेसी या ऑनलाइन फार्मेसी से खरीद लेता हूँ या खरीद लेती हूँ, because a lot of this skin lightening agent which they so carelessly over the counter they sell have a lot of steroids in them. Okay. And once you use it in the initial 1-2 weeks, you see very good results. That's how steroid works, right? It helps with lightening of your skin. It makes the pigmentation a little bit more lighter. Your skin gives that glow and you become brighter in shades. But the minute after 2 weeks that steroid ka initial flare is gone, its effect, you will have acne flare up. You can have, even if you're not acne prone skin, your entire life, your skin will become more sensitive to products. You will have the redness, that itching on your face post application of such products. You are more sensitive to sunlight now. So all of this will trigger what? It will again trigger the pigmentation on the face. So if you were again at a certain where you had only few spots on your cheeks or a few areas of your on your nose, now you have pigmentation that is extending completely on your cheek or your forehead and your nose, and you've made the situation even worse for treatment. So where we could have just given you a good sunscreen, a good lightening agents at home, now we need you to have two things at home, or we would have to step up the programs. Like it's like sometimes we could have just started from the ground floor and we could have just taken it to the first floor basic. Now we have to go to the top floor and then keep decreasing the agents, give a lot of counseling, give a lot of in-clinic treatments. So it just makes the situation bad for you. Right. So do not trust everything that is there. Check the degree of the doctor that you go visit. Check what experience they have. If they have pictures to show you that this is the effect that you can create or you can have, it is going to make such a lot of difference in your treatment line. And you will be safer that way.
Right. We all know, doctor, that diet plays a very important role when we talk of our skin. Skin, in a way, is a reflection of our body. What's going on inside our body is what our skin reflects. What kind of diet? Because in between the conversation, you said that a lot of antioxidants can help you combat the effect of melasma. So, what kind of diet we should go?
So when I talk about antioxidant diet, I basically say that it's a good way because there is an oxidative stress that is there in your body that could be triggered due to your hormones, due to your genetics, or due to the sunlight exposure that you see. So those oxidative stress, when you have the oxygen species that is there excessively, that can be reduced or at least be brought under control when you have a good green leafy vegetable diet, or you have a good fruit diet where which is rich in vitamin C, where you have these oxidative stress of your body can be decreased. There are a lot of supplements also that we have today, which is good, which is basically marketed as antioxidant this. But in the lifestyle changes, firstly, if you have some habits, like a lot of people, if they are into smoking, that again increases the oxidative stress of your body. If you don't follow a good green leafy vegetable diet, or you are not into a good home made rich diet, then again those oxidative stress in the body can trigger your melanin synthesis and it can affect the melasma. If you were supposed to have it a little less, it can get it worse. So this is the basic changes that you can make in your lifestyle that can make a difference for your pigmentation.
So a balanced diet is what we should go for. And I'll quickly take some of the questions asked by our viewers before we move to other questions that I have. So Rohit John is here. His question is, what can I do to prevent melasma from recurring after treatment? Recurrence is also common, doctor?
Yes. So I've firstly said it's a chronic recurrent disease. But if you have to control it and you don't want to get back to a state that you started with, firstly, a good sunscreen that you use it, you repetitive applications, wide spectrum, broad spectrum sunscreen that you use, and something at night care routine that you can add that helps with decreasing the melanin synthesis. We have products like azelaic acid that can be used very safely at night. You have kojic acid, a lot of combination other creams that can also be used that can help prevent the excessive melanin synthesis to take place.
Right. We have one more viewer with us, Suhana Thakur. Her question is, can hormonal changes or birth control influence melasma?
Yes, the first and the most common is the hormonal factors that you see, which triggers your this and your oral contraceptive pills. Here, it's the one of the major cause for melasma as well, because the oral contraceptive pills have a lot of estrogen progesterone combination pills. So estrogen progesterone in itself can trigger your melasma, and when you have a little excess in your body due to the oral contraceptive pills, the melasma is triggered with those.
Right. Rahul Batswar is here. His question is, are there any lifestyle changes I should consider to improve my melasma management?
So when you talk about lifestyle changes, I had just spoken about it being a good antioxidant diet, good lifestyle changes if you have any smoking habits or diet which is not good with leafy vegetables and all those things that you can change in your lifestyle, which makes a good impact on your skin. It helps your skin to glow, and it also decreases the melanin synthesis as well. So good lifestyle, a good diet is your go-to.
Right. A healthy lifestyle actually goes a long way. So Rahul, make it part of your life. I mean, just few lifestyle modification, and you'll reach there. We have Akanksha Puri. Her question is, are there any side effects of melasma treatment?
Per se, if you go to a proper dermat and a skin specialist, there are no side effects as such, because we use the products, we give you products which, after analyzing your skin, after analyzing your day-to-day habits, we make a regime that will help with the pigmentation. The only common side effects with these agents that you can sometimes see is an increased sensitivity to sun and the other products. So a few redness or a few times you might have that stretchy feeling because of these agents that we use on your skin. But everything can be taken care of. There's nothing that we might change. Some products don't suit for a particular individuals. So we can change the products, we can decrease that sensitivity, we can help. But apart from that, I don't see, even when you come to me or any other skin, even when we use the laser, it is perfectly safe. It's as safe as, because we just the pigment laser that we use for this treatment also, it only affects that particular pigment, so it doesn't have any effect on your healthy good cells.
Right. We have one more question by Sarvesh. Okay, so his question is that, can dark patches on the skin be related to autoimmune disease or other systemic health issues?
So when you see dark patches, that again comes under the spectrum of hyperpigmentation. So even on the face, when you see these hyperpigmentation on your face, there are a lot of chances you have lichen planus that can be seen. You have insulin resistance at acanthosis nigricans that we see on the face sometimes. You have sensitivity to certain products, and that irritation has left behind that pigmentation. And then you have your melasma that we're discussing today. So
Right.
what pigmentation we are talking about, what autoimmune condition that we have to, has to be from individual to individual. It's very broad spec to tell how this autoimmune disease can cause you pigmentation or not.
Right. So you go to your doctor in case you have any issues. We have Deepak Yadav with us. His question is, my face is very oily. Which sunscreen should I always wear?
So a good gel-based one is your go-to sunscreen. The brand you can choose, but you can select a good gel-based ones, because those gel-based ones do not clog your pores. It's non-comedogenic a lot of times, and it gives you a good shine without making your skin very sticky or oily in that way.
Right. As we have already talked a lot about how important the family history is. So, doctor, I would like to understand. For example, there is a person who's one of his or her parent is having the history of melasma. Now, what that person can do to prevent or prolong or delay the melasma?
So if you've seen your parents having melasma or any of your family member being affected by melasma, right from the age when you can identify that this pigmentation is going to be an issue, you start using a good sunscreen. Nothing else but a good sunscreen, a good diet will help at least reducing the appearance of the spots. When I say appearance, that means if it was supposed to come in the group of 20s for you, we can at least prolong it a few years and get it for 30s for you. So a good sunscreen, a good diet goes a very long way. And I cannot emphasize how much sunscreen helps in reducing the pigmentation. So good sunscreen is your go-to to prevent these pigmentation. Even if you don't use any other agents at night, the sunscreen and a good diet will help you a lot.
Right. And when we talk of sunscreen, the other, sun protective guards, the physical sun protectors like carrying an umbrella or, draping a scarf, etc., do they also help?
Yes. But again, when you use an umbrella, what material of umbrella are you using? The thicker the cloth, it is better to reflect back the sunlight. If you use some scarf to cover your, now again, the scarf, which material it is made of, how thin, how thick, also makes a difference in reflecting back the sunlight. So we advise the patients to use scarf of a little thicker quality so that the sunlight is completely blocked. We tell them more practical solution is to use a cap than an umbrella, because umbrella sometimes you are not able to judge where the sun is coming from. So a wide brim hat is what we recommend, especially if you are going on your beach holiday and you are going to sit in the sun for a long time. Then at
Mhm.
least a 4-inch wide hat is preferred in such cases. And then you use your scarf. You can use a good broad, even nowadays we have a lot of we have these sunglasses which is of a broad brim, so you can use those things also, and those help in protecting and reflecting back the sunlight.
Right. And before we sum up, any take home message for our viewers, Doctor?
My take home message today after all this discussion that I've had with you would be that first, if you see any signs of pigmentation, don't be scared to go visit a doctor. I am sure that the doctor will be able to give you a solution, or would at least be able to explain the cause of the disease to you, right? Secondly, don't fall into the trap of social media wherein they promote a lot of products, or some pharmacist is your friend, or you know that pharmacist by this relation, and you go and buy those products. Don't self meditate. It creates a lot of havoc for us. It becomes very difficult for someone to treat you. It makes your skin worse and even more pigment this. So use good doctor, go to a doctor, have an advice. It doesn't harm you in visiting a doctor once. Then whatever is the regimen that works for you, whatever is your budget, we doctors believe in giving you a thing that works in your budget, because overprice and everything doesn't work in day-to-day life, right? So a
Right.
budget friendly work will be done for you. You give your concern, and I'm sure every doctor today who's practicing here will have a solution in that for you. Secondly, if you are not in a state to at least go visit a doctor presently, invest your money in a good sunscreen. and that at least we can help prevent it. Don't use a lot of home remedies, because that again irritates your skin. And trust the process. I know it becomes a little tedious, it is a chronic condition, but you can reach to a point where it is very easily hideable. Like you can just cover it up with a little concealer or a little foundation and you're good to go. So get that self confidence back. The pigment should not be stopping from getting that confidence in you.
True. Thank you so very much, Dr. Rhea Shetty. It was wonderful talking to you. Thank you for making this session a very informative one. Thank you so very much.
Thank you so much.
And viewers, thank you for your active participation. Stay happy, stay healthy, stay connected. Goodbye. Have a good day ahead. Goodbye.